Hello, everybody. Happy Friday. It's been a fun week for us with Senior Advocate and with our company in Richmond, Partners in Healthcare. We had a really, really unique and fabulous Active Aging Expo yesterday. So we've been with the CenterWell people this week and we have quite enjoyed it. So thank you again for joining us today. This, of course, is our CenterWell series. It's called Doc Talks. So every month we have a different physician talk about a different topic. And so far, so good. We were able to record the last one. So I'm excited to say that we do have that on our blog. That is up on our website, senioradvocate.live. So I just wanted to tell you guys a little bit about CenterWell. Some of you are familiar with them and some of you are not. It is a new service and we are thrilled to be able to partner with them, not only on this series, but in many other ways and many other events that we're doing. CenterWell is a senior-focused primary care practice. So they have locations throughout Richmond, throughout the Hampton Roads area. Our speaker today, Dr. Jovan, is actually in the Richmond office. She's in the Laburnum CenterWell. So we're thrilled to have her come on. She's going to be talking, of course, about kidney disease. Let me say a few words about you before we start, Dr. Jovan, just so everybody knows a little bit about your background. Dr. Jovan joined CenterWell as a board-certified family practice specialist. She earned her medical degree in Germany in 1994, and she trained in the Department of Cardiac and Thoracic Surgery in Germany before she moved to the United States in 1999. She completed her residency in family medicine at the Middlesex Hospital in Connecticut, and then she completed her Virginia Geriatrics Scholar Program in 2022. Her honors include the Excellence Award from the McGuire Veterans Administration Medical Center in Richmond, Virginia. Dr. Jovan was an assistant professor of medicine at the Virginia Commonwealth University for 10 years. And before joining CenterWell in 2023, Dr. Jovan was a family physician with the McGuire Veterans Center in Richmond. She was also previously an associate physician with Harbor Medical Associates in Connecticut, and her interests lie in heart and brain health for older adults to help them live their best lives. Outside of work, she enjoys cooking, reading, and traveling. Wonderful. Well, we are going to jump right in. For those of you who are coming on who have not been on one of our Zoom programs before, we do allow questions. You can type in the questions in the chat box, which is over to the right-hand corner of your screen. If you don't see it, if you scroll down and put your cursor to the bottom of your screen, you will see chat is the fifth icon over. You just click on that. That little chat box will open up. You can also directly text me with your questions, 757-645-6364. I'm going to tell you that one more time, 757-645-6364. We will collate the questions during the presentation, and then we will be the ones that will be asking at the end. So take it away, Dr. Jovan. Thank you so much for joining us today.
And thank you for this nice introduction. So I'm going to share my screen so you all can see what we are talking about. This is what is happening with my kidney. So first of all, I want you all to understand that what's going on when you're aging, and also what does a kidney do? How does it work? What does it do? How does it change? What is impacting it? How can I help? Those are all things I want you to be familiar with so you have an input in your healthcare. The ancient Egyptians left only the brain and kidney in position before embalming a body, inferring that they held a higher value than other organs. They are correct, I think. So let's start with the basics. Where are they? You know, your kidneys are bean-shaped organs. They are about as big as your fist, and they are located on both sides of your spine. They are partially protected by your ribs, So they are really, really all important organs, are kind of well protected. Nature did what they had to do to keep us alive. So now we are getting a little bit more complicated. So how does the kidney work? Each of your kidneys is made up of about 1 million filtering units. They're called nephrons. Each nephron includes a filter called glomerulus and a tubule. The nephrons work through a two-step process. The glomerulus filters your blood, and the tubule returns needed substances to your blood and remove the waste. Here is a little picture, so it's kind of maybe easier to understand. You see the blue line and the red line. The red one is the one with the waste. It goes into your kidneys, then it goes into your glomerulus, and this very kind of sneaky structure is a nephron where the waste and the urine are getting separated. We will hear more about this later on. So what does the kidney do? It's a very busy organ, yeah? It filters your blood and removes waste products. It removes excess fluid. It removes excess electrolytes. It regulates your blood pressure and helps with acid-base balance. It also helps with red blood cell production. Your kidney gets about 20% of what your heart pumps out. For a very small organ, that's a lot of blood. So the waste removal, there are two wastes we all produce every single day. One is urea. This is created when proteins are broken down. Our body builds and breaks down proteins all day long. Then the creatinine. This is a byproduct of normal muscle use. So there, it has to get out. We need our muscles. We are moving our muscles. And of course, a lot of different drugs. So this is even more complicated picture, but essentially it's the same like the last one. So your kidney removes excess water. It's a complicated filtration process, which makes sure that you do not have too many water in your system and also still enough water in your system. It removes excess electrolytes. It's not only filtering the water, it filters the electrolytes from the blood, and it returns some of the electrolytes back to the blood. All excess are getting excreted in your urine. Those electrolytes, sodium, potassium, calcium, magnesium, and phosphorus. This way, it keeps the electrolyte balance perfect in your body. So it regulates the blood pressure. If you have a low blood pressure, your kidney starts to secrete an enzyme, which is called renin, into the bloodstream. This helps with constriction of the vessels, and also the kidney gives signals that you have to retain more sodium so that you have more fluid in you to get up the blood pressure. It also helps with acid-base balance. A neutral pH is 7. Your pH is always maintained between 7.35 and 7.45. It does it with reabsorbing bicarbonates from your urine and excretes hydrogen ions into your urine. You don't have to buy expensive alkaline water, ionized water. This is just a waste. Your kidney is able to do that very, very well. It also helps with blood cell production. The kidney makes a substance which is called erythropoietin, in short, EPO. EPO stimulates your bone marrow and tells them, hey, we need more blood, make more blood. And your bone marrow is supposed to respond and makes more blood. But of course, we also need iron, folate, B12, as a substance to make the blood in addition to the erythropoietin. And now one of the most important, it clears the drugs out of your system. I only listed a couple of them because it's a never-ending list, which are getting cleared by your kidneys. And I will read them to you, and I'm pretty sure you will recognize some of the names. Paracetamol, morphine, all kinds of antibiotics, beta blocker. You might be on a beta blocker. Benzodiazepam, diuretics, lithium, digoxin, ranitidine, baclofen. Maybe you have taken baclofen for muscle spasm. Pantoprazole. Maybe you take pantoprazole for your heartburn. And phenphalexine and a lot other ones. It works really well. We can be glad. Now we're getting to what's damaged your kidney. First of all, age. Unfortunately, there's nothing we can do about that. You know, we're aging and our kidney ages with us. But also things like diabetes, smoking, excessive alcohol, uncontrolled hypertension, high cholesterol, overusing painkillers, and abusing the salt shakers can damage your kidney. So what happens with age? So your kidney shrinks with every decade you live. At the same time, the number of the filtering units, the nephrons where we heard about, decreases. The nephrons are the busy part. They filter waste material from the blood. Also, the blood vessels supplying the kidneys can become hardened. This causes the kidney to filter blood more slowly. Like you can see on those little, on the renal function decrease list I have here for you. Even if you have the same creatinine, your creatinine clearance, that means what your kidney clears every minute, decreases. So even if you still have a creatinine of 1.3, when you're 70, the same number you had when you're 40, but it's no longer as effective as it was. For a healthy adult without any major medical problems, after age 40, your filtration rate decreases by about 1 milliliter per minute per year. At the same time, the renal plasma flow, which is about the same like the blood flow, decreases by 10% per decade. So 1% per year, essentially. So your kidney will decline some. Now we're getting what else can damage your kids. NSAIDs. You all have heard the word NSAIDs. Your doctor might have told you to take some, or your doctor might have told you not to take some. The official name for NSAIDs is non-steroidal anti-inflammatory drugs. They help with pain and with inflammation by blocking substances which can cause inflammation in your body and work as like a steroid, but they are not steroids. Here is a couple of names that might also be very familiar for some of them. Naproxen, Morphine, Toradol, ibuprofen, Voltaren, Advil, and so on. And also want to make you aware, a lot of patients sometimes take two from this list, but it's like kind of double dipping. You have taken much too much without knowing it. So the best thing is, if before you take any medication, over the counter otherwise, to ask your doctor. Here we have the generic name. This is not a complete list, but these are most likely the most common one, like meloxicam, ibuprofen, naproxen, aspirin, diclofenac, etodolac, indomethacin. That might all ring a bell on you. So those are some of the generic names. So now we have the drugs out of the way. What causes chronic kidney damage? Chronic kidney damage can be caused by hypertension, especially uncontrolled hypertension, which constricts the blood flow to your kidneys, and they can do their job as well. Also, diabetes can have an impact on the blood flow, and it also can have an impact on the nephrons, the one who do the actual work. Then high cholesterol. Unfortunately, it's not only going to the arteries in your heart, it only goes to vessels in your kidneys and reduces blood flow. And if you have a combination of those three, that's kind of really a big thing to handle for your kidney. Kidney damage cannot be reversed, chronic kidney damage, but you can work on minimizing the progression of the disease when you control all those risk factors. We also have acute kidney damage. Acute kidney damage is very often reversible. So it happens, but if you get better, your kidney gets better. The first and most common one is called hypovolemia. This is when the blood volume goes down, be it through bleeding, dehydration, medication. This all can cause low volume, reduced circulation through the kidney. Then urinary retention. It's often more a problem for men than for women because a lot of our men develop some enlarged prostate when they get older. Then they cannot urinate well, and the urine is backing up into your kidneys and damage your kidneys. Then, if this is treated fast, it will be fine in a couple of days. Of course, there's also infections, medications, toxins, autoimmune disease like lupus, vasculitis, which can acutely damage the kidney, but can be reversible with therapy. Now, the big question, how can you help? First of all, you can protect your kidneys by preventing or managing health conditions that caused kidney damage, like we already were talking about. And there's a more how. Yeah, you all have heard that too. Lifestyle modification. That's what your doctor tells you. You have to work on lifestyle modification. But what are lifestyle modifications? First of all, healthy food. Cut down on carbohydrates, less rice, less starch, less sugar. Avoid drinking juice and sodas. If you want to have an orange, then eat an orange. Don't drink the juice. Avoid eating processed food. Avoid alcohol. If you smoke, quit smoking. So here, what's processed food? Processed food essentially is any food which has been altered from its origin. So, for example, you have the grain, you mill the grain. Now it's already minimally processed. And the more you process the food, the worse it is for your body. We all go most likely mainly in the group 2 or 3 because that's only vegetables and fruits, milk, which we might eat unprocessed, but we're all pretty much in group 3. We eat our bread, we eat our cold cuts, we eat our cheese, our canned vegetable. But what you should really avoid or only do on certain occasions, it's what's called ultra processed food. That's your potato chips, your chocolate, your hot dogs, your Cheetos, or whatever strikes your fancy. So they are not good for you. So it's okay to eat them occasionally, but it should be an exception and not the rule. So what can I eat? I told you all the things you're not supposed to eat. So let's see what you can eat. You see here, especially nuts, beans, vegetables, whole grain, fruits, low-fat dairy products. Those are all the good ones. The one on the right lower side, you have to limit. Meat, go for white meat, go for fish, do 1 or 2 vegetarian days a week. And the sweets. Yes, of course, you can have your piece of cake when you're at your aunt's birthday, but let be one piece and not every day. Here's a little more. You all have heard that already. Don't use salt when cooking food. Don't put salt on the table when you eat. Learn to read food labels. That's a big one. Because if you cannot read the label, you might make mistakes. For example, you think, okay, oh, it only has 300 milligrams of sodium per serving, but you kind of overlook that you just ate 3 servings. Also, try to avoid foods that have salt as the first 4 or 5 ingredients on the list. When you eat canned stuff, look for the low sodium soups, the low sodium vegetables, and what we all always say, control portion size. Yeah, because I always tell you, you can eat whatever you want. Yeah, but you have to eat it on how often as you really should. Yeah, so if you want to have high processed food, yes, go for it. Go for it once a week, once a month. If you want to have red meat, okay, make a deal with yourself. Have it once a week. Just everything in moderation and control portion size. That's a big one because it's very difficult. And we all looked at those lists on those labels and say, what? 15 chips is a portion? So try to stick with it. We already talked about the no salt, and also there are often nowadays lower salt options of a lot of things. Take a look for that. Refrigerated or frozen meats that are packaged in solution or have been flavored or pre-seasoned usually have a huge amount of salt. Please don't purchase them. They are more expensive and they are not very healthy. Do it yourself. So now more things you all have heard. Avoid too many painkillers, especially NSAIDs. Lose weight when you're obese. Make yourself a weight loss goal, yeah? Don't go with, I want to lose 50 pounds. No. Tell yourself, I want to lose 2 pounds by next month. Or I want to lose 10 pounds in 3 months. Something where you can see your goal and not it's so far out, you cannot see it, no matter what you call. Drink water. 1.5 to 2 liters a day. This is about half a gallon. You don't have to chuck a gallon to get this done. Just 1.5 to 2 liters a day. Exercise. You all have heard that. You have been asked multiple times. Swimming, walking for an hour a day, brisk walking for 30 minutes a day. If you're unable to do any of this, if you only can walk for 10 minutes, then walk 3 times a day of 10 minutes. If you're not able to walk at all, look, there is plenty out there on YouTube on chair exercises. There's something for everybody. Just take a look and you will find something. Okay, now we are getting what should we do if we already have advanced kidney disease. This is not for everybody who has advanced kidney disease has this problem, but usually dark colored sodas contain phosphorus. Avocados are high in potassium. Canned food is high in sodium. Whole bread and brown rice are high in phosphorus. Bananas, oranges, and orange juice are high in potassium. Dairy products are high in protein and phosphorus. Processed meats, which are high in sodium and sugar. Tomatoes, which are high in potassium. Like we heard earlier, the nephron is the one who gets those stuff in and out, the phosphor, the potassium, the sodium. So if it's not working too well, you don't want to make it work harder than it necessarily has to. Now, finally something positive, yeah? what's helping with progression of kidney disease? There are three big groups. One is the angiotensin converting enzyme inhibitor, in short, ACE. A couple of them are listed here, like lisinopril, captopril, enalapril, benzapril. You might even take them. Or the angiotensin receptor blocker, losartan, valsartan, candesartan, and other sartan. And the newest kid of the block, so the SGL2 inhibitors. Oh, I always forget what the name is, so I have to look it up, but it's sugar, no, it's, give me a second, I will find it. That's always the one here is sodium glucose cotransport 2 inhibitors. Okay, so that's a mouthful. So that's, for example, empagliflozin and dapagliflozin. A lot of those medications are most likely familiar to you. Sometimes your doctor starts you on them even if you don't have high blood pressure, for kidney protection when you have diabetes, when you already have some problems with the kidneys. Those are kind of not only for blood pressure, they are also helpful for your kidneys. So, stages of chronic kidney disease, so we know what we are really talking about. The majority of us are most likely in stage 2, which does not mean that we have to go on dialysis anytime soon. It only means that our kidney works about 60 to 90%. You won't have any problems with that. You should go easy on the NSAIDs, but otherwise, no problems. Then we're going to stage 3. Stage 3, you have 30 to 60% of your kidney function. Here, you're already in a stage where you want to kind of avoid kind of irritating your kidney anymore. You really, really want to make sure everything is good. Then this is something now at stage 4, you might notice some changes in you. And at stage 5, when your kidney only works 50% or less, you're usually kind of preparing to have something like dialysis. But let's not go there. You know, the majority of us is most likely at stage 2. So here are the symptoms of, unfortunately, you don't really have real symptoms until stage 4, but your doctor always will monitor your kidney function when he does the blood work to make sure you're on the right medication, to make sure your diabetes is controlled, to make sure your blood pressure is controlled, your cholesterol is controlled. So the early signs can be, or early late signs, I would call it, foamy urine, changes in your urination pattern, fatigue, feeling cold when others are warm, like we were mentioning. EPO, kidney makes EPO and tells our bone marrow to make blood. Chest pain or shortness of breath. Kidney pain is usually kind of unusual, but it might happen. Then swelling of your legs, rashes and itching, metallic taste. And if you really kind of are unable to clear your waste, you also might have nausea and vomiting. So I don't really have to tell you anymore. I gave you, hopefully it was helpful, an overview. And it's obviously worse to pass a kidney stone than giving birth to a baby, because people always say they want another baby, but no one ever wants another kidney stone. Thank you very much for your attention. I hope it was helpful for you, and come for a tour and take a look. We are accepting new patients. Thank you.
That was very, very interesting. I think that the kidney is a part of the body that people don't know a whole lot about it until they have problems with it. So I think that was just very educational. We got a few questions in. One question was, at what age does kidney failure usually appear? Is it mostly an older adult's disease?
So if you're healthy, it usually starts to decline around 40. But Some decline is normal because it's aging, and we all age if we live. Of course, if you have diabetes, high blood pressure, high cholesterol, you have a higher chance of a decline of kidney function, especially if they are not controlled.
Okay. Another question was, is kidney failure or kidney disease, has it become more prevalent because of the increase of people eating more processed foods?
Yes, it does become more prevalent, but not only because of processed food, because also of obesity. We have more and more diabetes. We have more and more people with high blood pressure. We're always coming back to these problems.
We have one other one. Somebody asked, where would you find information about if you were having kidney problems? Is that going to show up in your blood work? I know you mentioned some of the symptoms that you feel, but if you don't have any symptoms, how else can you tell?
You cannot. It's impossible. Yeah. So because you only get symptoms when you're already in a very advanced stage. But if you have regular follow-up, your doctor, depending on your problems, will check your kidney function at least once or twice a year. So any changes will be noticed. And you
Okay.
and your doctor can work out a plan.
Okay. We got another question, and someone wants to know specifically, how does high blood pressure affect your kidneys?
It constricts the vessels. That means that the blood flow to the kidneys is getting reduced. So the kidneys cannot work on full capacity.
All right. I think that is it for the questions. Thank you again so much, Dr. Joven, for joining us today. I just wanted to let everybody know that our next month, on April the 5th, we will be hearing about stress awareness and relief techniques. I think that's something we could all use. That will be by Dr. Banerjee, of course, another wonderful CenterWell physician. So thank you so much for joining us. If you want to find out about other events that we have, you can certainly view our website at senioradvocate.live. Thank you again. Have a wonderful weekend.
Thank you for listening, everybody. Bye.
Bye-bye.